Dr. Shah, and today I'm going to explain to you how to maintain and clean your oral device, as well as how to use your morning retainer. Now, the manufacturer recommends not to scrub your device with a toothbrush because it can cause microfractures in the device and the accumulation of bacteria and plaque buildup, as well as not to use toothpaste, mouthwash, denture cleaners, or soaps on your device because they can be too abrasive and cause the materials to break down. So what do they recommend instead? They do recommend you always use room temperature or cooler tap water, as well as a cleaning agent such as a tablet or powder and a sonic machine. The sonic machines are much more effective than scrubbing it with a toothbrush, where with the toothbrush the fastest that we can scrub is about 300 times a minute, whereas with the sonic machines, the battery powered ones can go at about 15,000 times a minute, and the plug-in ones at about 45,000 times a minute. So they're going to be much more effective. The battery-operated one that we have here takes batteries as well as has a manual switch in the back. So you do have to turn it off when it's done cleaning at about 15 to 20 minutes. You fill up the container about halfway with water. Don't go any higher than that because once you put in the cleaning agents, your device, and you turn it on, it will foam up a little bit and could leak over and damage your sonic machine. So halfway is fine. You can put everything in here, close the lid, turn it on, turn it off in about 15 minutes, and then empty everything out and just let your oral device and aligner air dry. The newer sonic machine we have is one that we're very proud of because it was designed based on the feedback from our patients. It has a plug-in, so it has a charger where you don't need batteries. It has a UV cleaner as well, and the sonic machine oscillates at 45,000 times a minute. The compartment is also shaped rectangular, so it holds any device in a lot better, and you can put both in at the same time. Just fill it up to the max line that is indicated there with room temperature or cooler tap water. You can put your cleaning agent like tablet or powder in there. You close everything up, turn it on, and it will turn off on its own at the end of its 3-minute cycle. So this will complete cleaning in just 3 minutes, whereas this will require 15 to 20 minutes, and for you to turn it off manually. Again, once everything's done, you take it all out and let it air dry. My experience has shown that using the sonic machines and the cleaning agents just 2 or 3 times a week is sufficient to keep your devices clean and to kill all the bacteria, to disinfect it, allowing them to last their full life, which is about 3 to 5 years. The days that you're not using these tools, you can just rinse your device under water and then just let them air dry. In terms of the cleaning agents, our newest tablets have been fantastic. The ingredients are all natural. They do, however, include some walnut oil in there, so if you have any kind of nut allergy, you do not want to use this. And again, this should last at least 6 to 8 months. The tablets are also easier to travel with. The powder is where you want to just fill up the cap about halfway with the powder, put them in the sonic machines, and use them the same way. Now, in terms of using the morning repositioner, you want to use this for about 15 minutes. We recommend you at least wait a couple hours before using it, so sometime before lunch. It just makes it more comfortable and allows your jaw to kind of ease back to its original position instead of pulling it back too quickly in the morning. Now, if your schedule does not permit, it is okay to use this immediately in the morning as long as it's comfortable for you. We recommend maybe incorporating it sometime in your schedule, maybe after breakfast, in the car to work, or when you're exercising. You wear this on your bottom teeth for about 15 minutes. You just gently open and close on it every few minutes. So you can open and close a few times every couple minutes, and the times that you're not opening and closing, you just gently close and bring your back teeth against these pads that are here. Now what this will allow is for your muscles to relax, pulling your jaw back to normal. It flushes fluid out of your jaw joint, which naturally accumulates at night when using the sleep appliances. It's very, very effective at reducing the risk of side effects with your device, such as with jaw pain or TMJ, as well as with bite changes. That's about it for me. If you have any further questions, feel free to reach out to a member of our staff. Thank you very much, and good luck with your treatment.